The PMedicine project was started because I had a vision that at least in the cancer domain we have a problem. In childhood oncology we always can cure many of our patients, most of them will be cured actually, but we are coming to a threshold where there is no possibility to cure them with the methods we have today. And therefore cooperation between different stakeholders coming from medicine on one side, but also from the IT perspective, software engineers, legal people and others have to work closely together to get new insights in diseases and find new treatments. And that might be possible by looking in all the data you have created in one of the patients. It's not only clinical data, it's also imaging data, it's research data. And put them together, you will find new knowledge and wisdom out of these data, and this wisdom might pass you the way to personalized medicine. And that's it why we started with this PMedicine project. One of the pitfalls is really that the different stakeholders need to understand each other. So we are speaking different languages and we are not used to the language of the other stakeholders. And to overcome that is really necessary. And in the first years when we worked together as a group, that was really some of the pitfalls we had. But we adjusted that and now we are understanding perfectly. And so they do know from the IT side what we as clinicians want to do and get, so that we can adjust what we want getting from them. And that's one of the most important pitfalls which we have solved. Another pitfall is the questions about the security of data. And this is really very important because if we want to use personal data, we must guarantee security of the data. And therefore one of our stakeholders are people coming from the legal perspective and the ethical perspective, and we have built up a legal framework in PMedicine which acknowledge all of these different regulations you have, and this is one of the most important actions we have. And the third one, which I believe is really maybe the most important, we are doing that for patients. So patients should be in the center of our thinking, and therefore patient empowerment is very important. It doesn't make any sense if we will develop tools that are not useful to treat patients or to make the diagnosis faster, better, or getting better treatment to the patients. So we need to put patients into our considerations from the beginning. The main benefit might be that patients will really much more involved in their disease. So we want to tell patients more about their disease, to understand their disease and how they can contribute really to get a better treatment and really get a better outcome at the end. And therefore the tools, or part of the tools we are developing, are tools for patient empowerment. And I hope that these tools will really make a benefit for patients. The benefit for clinicians might be by generating new knowledge and wisdom out of all the data we have, that would make it much easier to find the right treatment for their patients. And this is something which I believe will also help them to get better treatments and to have higher cure rates for patients.